Now let's review anemia and pica. So let's cover some key points from our MedSurg course that includes the top tested maternity topics.
Anemia is our next big topic. In general, this is a condition where the body lacks enough RBCs, those red blood cells, to carry oxygen around the body to perfuse the tissues, typically resulting from blood loss, like surgeries or excessive menstruation, or even from taking immunosuppressants, which suppresses the bone marrow where RBCs are made, but more commonly from the lack of iron, B12, and other building blocks to build RBCs. Another known cause is during pregnancy. The fetus stores iron and it depletes the mother's iron storages, typically during the first trimester or during the second half of pregnancy. Now, pica is a very interesting cause. You mean Pikachu? No, not him. Pica is a very serious compulsive disorder where clients consume non-nutritional items like cornstarch, chalk, dirt, paper, and other items, typically occurring in pregnant women. So obviously this will lead to nutritional deficiencies, mainly iron deficiency, leading to anemia. So these clients will usually present with low hematocrit and low hemoglobin levels. Huge NCLEX tip, I would write that down. So low H&H with clients with pica. 70% of students get this wrong. So once again, think low H&H with pica Pikachu, or just pica. Now for infants and children, they often develop iron deficiency anemia from the following risk factors. Number 1 is premature birth. Number 2 is insufficient oral intake, or delayed introduction of solid foods. Now a big one and a huge NCLEX tip is number 3. Excessive intake of milk. Again, write it down. Over 24 ounces of milk per day. Now, preterm infants who are exclusively bottle fed with breast milk, as it contains low iron, are typically recommended to take iron fortified formulas. Now, a huge NCLEX tip here is the vegan diet. So be sure to write these key points down. Vegan diets exclude all animal products like dairy and meat. So number 1, fortified breads and cereals are recommended. And we always pair, number 2, high iron foods with high vitamin C, as it helps the iron to absorb. And number 3, calcium and vitamin D is recommended to supplement the lack of nutrition from the dairy. So write those 3 key points down for vegan diets. They love to come up on Select All That Apply questions as it applies to iron deficiency anemia. Now, in terms of diagnostics, as mentioned before, the big NCLEX tip is knowing the hemoglobin levels. So once again, normally it's above 12. Now it's bad between 8 and 9, and less than 7 sends your patient to heaven. Remember, you must know these key numbers here, so write it out and know it by heart. As stated before, clients who are pregnant are expected to have low hemoglobin, less than 11. But it's very bad if we dip below that 9. So always report to the HCP immediately. Remember, anything less than 9 is bad, but less than 7 sends your patient to heaven. Now for the signs and symptoms, just make it super simple and think about the patho here. We have low RBCs, meaning we have low hemoglobin, resulting in low oxygen signs and symptoms. So we get fatigue with dyspnea, that shortness of breath, as well as dizziness and even paled skin called pallor. But the top 3 to know is dyspnea, pallor, and tachycardia. Now Hesse mentions, when assessing the patient's integumentary system, which dermatological manifestation may indicate anemia? Pallor, yes, that pale skin. So just watch out for that key term, pallor. Now for the top tested treatments, you must know dietary sources that are rich in iron. This includes number 1, meat, fish, and poultry. Remember, they contain the richest source of iron that is readily absorbed in the stomach. Now number 2 is spinach or green leafy, as well as whole grains. Again, fruits and veggies, beans and nuts, and whole grains do have iron, but it's not as easily absorbed as meat products. So on the NCLEX and your nursing exams, always choose meats. So Kaplan mentions, the nurse counsels a client diagnosed with iron deficiency anemia. The nurse determines teaching is effective if the client selects which menu. either flank steak with green leafy vegetables or liver and onions and spinach. And Hesse mentions, a nurse is educating a patient with iron deficiency on the foods high in iron. Which meal, if chosen by the patient, demonstrates understanding of iron-rich foods? Grilled chicken thigh, see? Always the meats, as well as sauteed spinach and whole grain breads. So always choose the meats, and you should get the entire question right. Now for infants and children, we always limit excessive milk intake, since milk is low in iron, and we always encourage oral intake of iron. Now another key point is iron and vitamin C. We always take high iron foods and high vitamin C. So foods that are rich in vitamin C is like orange juice. This can enhance the iron absorption when taken with iron-rich foods. So Hesse mentions, a patient with iron deficiency anemia is to be discharged home with iron replacement therapy. Which instruction would be most important to maximize iron absorption? A glass of orange juice. Now, as far as iron administration, let's play a segment from our pharmacology master course. First up is iron, aka ferrous sulfate when taken orally, and iron dextran when taken IV or IM. Now, it's given to treat anemia related to iron deficiency. It's basically the building blocks for RBCs, those red blood cells. So big patient education key points here. Any dark or black stools, guys, these are normal and to be expected, not a GI bleed. Probably the only case and scenario where it's to be expected. Now, it's taken on an empty stomach 1 hour before the medications. So guys, iron blocks absorption of all meds. So just think that the stomach is like a wrestling mat and iron is like Iron Man. Basically blocks and dominates everything. But here's the trick. Vitamin C actually helps with absorption. But guys, not taken at the same time. So Kaplan and Hesse says which one is a medical error? Well, when calcium is given with ferrous sulfate. Guys, the key term there is with. So blocks absorption. All right, that wraps it up. Thank you so much for watching. Don't forget